Good morning, everyone. We'll go ahead and get started. I'm Senator Saud Anwar. I'm the Senate co-chair of the Public Health Committee. I'm here with my House co-chair, Representative Kristen McCarthy-Vahey, as well. We are joined here today with a number of people who are providing health care in the state of Connecticut. We're here to talk a little bit about Senate Bill 1. And Senate Bill 1 has a number of different parts to it. The part that is very critical for our conversation this morning is about cybersecurity. Just a few months ago, 3 of our hospitals in the state of Connecticut were under a cyber attack. And in some 40 plus days, the 3 hospitals were without access to internet, without access to be able to connect internally with the various parts of the healthcare system. And what we need to recognize is that technology is ubiquitous. Technology and network is such an important part of healthcare that the medications, the tests, the blood tests, the radiologic tests, and the communications between various parts of the healthcare systems are completely seamless with the technology. And we have the next generation of workforce who only know this form of communication. And when there is a cyber attack which takes that away, the individuals who have not seen the historical other ways of being able to do it without technology, they are unable to do it seamlessly. And that's part of the reality that we are all dealing with at this time. You may see this physical structure of the hospital there, and we will see, oh, everything is fine. But the physical structure, even though it looks good from the outside, the internal workings can be severely impacted. And its unfortunate reality is that it's not a matter of if, it's a matter of when more systems would be impacted. More healthcare systems would be attacked by the cyber criminals. And that's the reality. And what Senate Bill 1 is looking at is a way to have us be better prepared. And the reality is, if you fail to plan, you plan to fail. And that's what is important for us to act collectively as a state of Connecticut need to do better to be able to plan in advance. And this will require exercises, this would require coordination, and that's why we are here today to talk about this. I wanted to thank Senator Looney, Senator Duff, who have made this one of their priorities in the Senate Bill 1. And with this, we know that 90% of the healthcare organizations in the United States have had some level of phishing attacks. And the AMA has determined that 36% increase in complications after a cyber attack in the patient's welfare. So at the center of our conversation today for better preparation is the patient. And if the patient's well-being is going to be impacted, we have to come together for that purpose. And that's why it's important to be better prepared. That's why it's important to actually have the coordination, but it's also important to have partnership with all healthcare providers at every level, to be able to be trained to work with and without technology and be prepared in every single way. And that's part of the bill where we are coordinating with the Connecticut Hospital Association on a regular basis, at least a yearly basis, a conference as well, where there would be hands-on opportunity for individuals to work without technology, to be able to see what they would do if there was no communication systems and the EMRs were down. And that's one big part of the bill. The other part of the conversation today is going to be about health information exchange and the collection of data. Anytime these cyber criminals look at the opportunity, they want the maximum benefit from their attacks. And whoever is going to have the data, the largest form of data, they're going to try to see what they can do to impact that. And that's relevant for us to be prepared in advance. So you'll hear from many of my colleagues and partners in this effort about this. But first, I wanted to have my partner, my House co-chair of Public Health Committee. I was going to say doctor, but she's essentially a doctor functionally because she's been working in amazing manner for our Public Health Committee, Representative Kristen McCarthy-Vahey.
Thank you, Senator Anwar, and thanks to all of you who are here today. What a tremendous turnout for this conversation, which speaks to the importance of these issues. And the fact that we are all so connected. we talk about internet connection or connection in a lot of different ways. And so this conversation around security just highlights how that connection can be impacted and how the lack of connection can actually impact our health. And I know that this is a sensitive topic to talk about. And when we talk about cybersecurity, we want to be able to talk about what we need to do publicly as a public health committee and as a legislature. But we also know that there are some things that we don't talk about here publicly that have to be talked about privately in order to continue to maintain that security. But we know, too, when it comes to data, that's the other part of this conversation, cybersecurity and the data piece. We rely on data in public health. We rely on understanding where population health is, and we certainly all support that understanding. But we know that it has to be done in a way that protects our patients and protects our residents, as Senator Anwar said. So I look forward to continuing to connect with all of the providers who are here to make sure that we're offering the best and safest opportunity for the best outcomes for the people of the state of Connecticut. Thanks, Senator, for all your hard work on this and for all the partners who are here with us.
Thank you. Thank you, Representative Christian McCarthy-Vahey. The next person on our list is one of our partners with Connecticut Hospital Association, who are front and center in this effort, Paul Kidwell. Paul.
Thank you. Good morning, everyone, and thank you to Senator Anwar and Representative McCarthy-Vahey for bringing us together on an issue of just extreme and paramount importance for hospitals here in the state. As Senator Anwar and Representative McCarthy-Vahey indicated, the data is a powerful tool to make sure that we're providing the best clinical care in every setting across the state, but also that we're improving the health of our communities using that data to understand where we're deficient and we need some investments in that community health. At the same time, we have to make sure that everyone in the state of Connecticut feels like their personal information is protected and that we're doing everything we possibly can to make sure it's protected and used in an appropriate way. It has huge ramifications for privacy and huge ramifications for clinical care. And we should all be eyes wide open. We're dealing with sophisticated and nefarious actors that are global in nature, and they are looking to attack not just healthcare, but other sensitive information daily. And we need to have a comprehensive and sophisticated plans in place to thwart those attacks. Hospitals every day are building redundant systems, testing those systems, and making sure that that data is protected. But hospitals can't do it alone. We need an entire universal approach, all providers, the state government, our third-party vendors, to make sure that we are closing all of the critical vulnerabilities that we have in our system. And as Senator Anwar noted, the attack on the 3 hospitals in our state recently, but also the attack on Change Healthcare and what that meant for patient care and for how America's healthcare system has been built and developed. We're vulnerable in a number of places, and that's why, as Senator Anwar and Representative McCarthy-Vahey noted, it's going to take all of us working together to make sure that all of those critical vulnerabilities are closed. And so we really appreciate the opportunity to work collectively, not just in this legislative session, but in an ongoing way to make sure that people in Connecticut, our patients, feel very comfortable that we're doing everything we possibly can to support them in their clinical care delivery, but also in protection of their privacy. So look forward to hearing from the rest of my colleagues here and continuing to work on this issue together. Thank you.
Thank you. So if you look at the coalition of healthcare workers, healthcare providers, people who are joined today, there's essentially nobody that's left out. And then when I saw this list, and I said, well, if we can get this list together and people to work together, we have solved all the healthcare issues in the state of Connecticut, because you sometimes in the Public Health Committee, we are seeing individuals who have issues between each other, different organizations. But this is one place where there is complete unification from everyone who is providing any form of care to people in the state of Connecticut. And that's heartwarming, because at the center of all of this is the personal health information, the protected health information. And that's where everybody is unified to say, how can we make sure that our patients' information is going to be safe? And I think that's the center of it. Now, within the definition of what is safe, there are more important issues. For example, some of the people's reproductive health information. We want to have that protected. We want to make sure that if there's somebody who's having gender reaffirming or affirming care, we want to make sure that's protected. And there are individuals and groups that are out there to try and get that information and other information about individuals' mental health, substance use, and so on. And that's something that's vulnerable. The more technology is going to try to be part of our healthcare situation, the vulnerabilities do increase. Our next speaker is Amanda Gonthal, who is the president of the Connecticut Association of Ambulatory Surgery Centers. Amanda.
Good morning, everyone. My name is Amanda Gunthal. I currently serve as the president of the Connecticut Association of Ambulatory Surgery Centers and our patient safety organization as well. I am here today on behalf of 29 provider groups and organizations that include thousands of physicians, nurses, mental health providers, surgery centers, hospitals, and others who care for hundreds of thousands of Connecticut patients to highlight our collective concerns with Connecticut's health information exchange. It is critical that we work together to ensure the protection of patient data and the providers responsible for the privacy and confidentiality of their patients. The recent Change Healthcare cyber attack and data breach highlights the need for vigilance and action. The interconnectivity of health information offers valuable insight and data that can allow us to provide more efficient healthcare to our patients. It is crucial, however, to navigate the current landscape with caution, safeguarding both patients and their health information and their healthcare providers from potential risks and breaches. We commend Senator Anwar for creating a forum to address the concerns outlined by our coalition as he seeks to protect the safety and security of patient health information in Connecticut. The proposals that will be in SB 1 create a working group with key stakeholders, including members of this coalition, that will create a path forward whereby the state of Connecticut, the Health Information Exchange, the Public Health Committee, and Connecticut's healthcare providers can work together to find solutions that will benefit patients and providers alike and create the protections necessary to see the benefits of a well-thought-out, safe, and effective health information exchange. Thank you.
Thank you, Ms. Gonthal. And the next person is Dr. Anthony Yoder, who's the president of the Connecticut Chapter, American College of Physicians. Dr. Yoder.
Thank you. Good morning, everyone. I would also like to express my gratitude for being here to discuss this important topic. My name is Dr. Anthony Yoder. I am a board-certified internal medicine physician and also serve as the chair of the Health and Public Policy Committee for the Connecticut chapter of the American College of Physicians. We represent over 2,300 practicing physicians here in Connecticut. One of the great challenges of receiving healthcare from different clinicians, practices, and facilities is the communication needed to ensure timely exchange of information is present. This is critically important to ensure both safety and efficiency. As examples, a patient being treated in office was seen in the ER 2 days ago, and the clinician needs to know what happened. An ED clinician is treating a patient who had a post-op visit last week, or a specialist has a patient who had diagnostic testing in a different facility several weeks ago and needs access to that information. We can all recognize the importance of greater interoperability of our health information, so long as the appropriate safeguards are in place, and that is the focus today. In 2020, the American College of Physicians, our national organization representing over 160,000 practicing physicians, released a policy paper outlining the necessary principles for healthcare information privacy, protection, and use. As frontline physicians who use these technologies every day, it is our hope that implementing the recommendations outlined in this paper will help ensure more comprehensive health information privacy and security protections. We believe that these principles must guide our efforts here in Connecticut and serve as the framework for the concerns we have outlined with Connie and the Health Information Exchange, together with 28 other healthcare organizations and groups. Our patients must be able to trust in the power of digital health technology and are only able to do so if they feel and are confident that their private information is being safeguarded on all levels. As you've heard in a recurring theme so far, the recent Change cyber attack and the Prospect Health attacks in the last year further underscore the importance of taking action on this here in Connecticut. When you consider the breadth and depth of those who have expressed concerns with the way the Health Information Exchange is being developed, it is clear that additional work is needed. We join our health colleagues here today to commend Senator Saud Anwar and the leadership of the Public Health Committee for their efforts to include a Connie working group in Senate Bill 1. This will bring together key stakeholders in an effort to find workable solutions that will protect patient health information and the clinicians and healthcare organizations responsible for ensuring its privacy and security. We urge passage of this critically important legislation. Thank you.
Thank you so much, Dr. Yoder. We have multiple other parts of our healthcare system, individuals who are doing work every single day who are represented here, but we will take questions if anyone has any questions. Yes, please. Sure. So the question is about what does the bill do about the health information exchange? We are creating a working group with all the stakeholders, including the Office of Health Strategies, in the same room to discuss about the various parts. In healthcare information, there are many moving parts. There needs to be clarity. If there's a breach, who would be responsible for addressing that? In the information, there's some parts of the protected health information of an individual. We want to make sure that the conversations need to happen. How are those going to be scrubbed? How is that information going to be looked at? Right now, the state of Connecticut looks like you have to opt out. And some of the people may feel that they should have to have opt-in rather than opt out. So that's a conversation that's worthy to have as well, depending on the patients. So there are, what is a rapid response? Who is going to communicate if that data is breached? Who's going to communicate with the patients about that? And who's going to be legally responsible? So there are so many parts of this issue that are not resolved. And also at the end of that conversation, we hope there's going to be some legislative thoughts that will come forward that we would actually put it and codify that in a manner that is going to be more protective. And at the center of this, while we want all the data, it's important that the patient health information is protected and we can actually feel assured that everything is being done to make sure we are taking care of that. So those are some of the things, and I'm sure there's more, and anybody who wants to add, you're welcome to do so too on this.
Can I just, one of the things we learned in the Change Healthcare breach was information between partners is really important because we all have connections with each other, and we need to understand when do we need to sever our connections so that we're not continuing to expose the entirety of the system. So those are the types of conversations we want to have with the state about what are the rules of the road that make sure that we're doing everything in our power to protect the data at every step. And so that's just one example of a firewall that needs to be put down when someone feels like something's been breached.
Any other questions? Yes.
How is the bill changing with regard to repairs at the hospital?
So the bill will change. During this session, what you have seen is because of the budget, the current version of the bill is associated with a number of financial aspects to it, with the involvement of the Department of Public Health and other health care agencies who are in the picture in the bill currently. So as a result of that, the bill language is going to change so that the entire conversation would be happening on the hospital preparedness within the healthcare systems. They would be doing it, but they will be communicating with the Department of Public Health to share their plans, and that would just make sure that everybody is well prepared. And that part is slightly changed. The other part about the conference and actual hands-on preparedness plans, that is going to stay the same.
So it would be incumbent on the hospital to provide preparedness plans to the state on an annual basis?
Yes. And they're already doing it, but what this would do is that the Department of Public Health will be involved, and there will be areas of opportunity to look at what can be done. And this information will be protected. In other words, you cannot get that information on what vulnerabilities may be there. So it's a quiet effort to try and make sure everybody is better prepared. And there will be areas of opportunity perhaps in future when we have budgetary opportunities.
And what would those reports entail?
The reports will entail the hospital's checklist of the various components that they're supposed to take care of. And this is some of the insurance, cybersecurity insurance have requirements. And it's based on the cybersecurity requirements and the checklist of all the things that each healthcare system should be following, and make sure that they are actually following those.